Atavistic chemotherapy is not an alternative treatment for cancer, but simply a clinical trial to evaluate a new form of drug-based therapy that we believe is the correct way to treat cancer based on the biological origin and behavior of cancer cells. Enrollment process. If you are interested in undergoing atavistic chemotherapy to treat your cancer, please review on our website Patient Information Package contained in the Patient Portal. Eligibility criteria for patients to join our trial are: inclusion criteria. Patients with malignant disease confirmed histologically that is considered untreatable, progressive, and fatal within the next 16 months. Patients with an expectation of life greater than 3 months. Patients with malignant disease that may be evaluated or measured clinically, either through radiographic studies, visually, histologically, in serum or blood tumor markers, or through any other method medically approved for that disease. Exclusion criteria. Patients over 75 years of age, patients who are pregnant, patients that have a known allergy to any of the drugs planned for use, patients with renal, hepatic, pulmonary, cardiovascular compromise, or other systemic or other clinical conditions such as AIDS, tuberculosis, etc., which in the opinion of the investigator may pose a risk to the subject. Malignancies of hemolymphatic origin, leukemias, lymphomas, and myelomas. The informed consent process. All patients must read, understand in full, and complete an informed consent form, accepting treatment with atavistic chemotherapy's benefits and potential risks, if any. All patients in clinical trials are volunteers. You can choose to quit a clinical trial at any time, but talk to your doctor first. Once you have read all necessary information and discussed your case with Dr. Arguello, and you or your relatives have asked all questions, we may proceed with the registration and informed consent process. Please click the link to register and complete the consent form. Frequently asked questions by health providers. Do you have other NDs or clinics in Canada as part of your clinical trial? Most of my patients are from Canada and referred by NDs. I have even visited patients directly in Canada. However, I am not licensed in Canada. Thus, my role is learning the patient's case and providing my opinion whether this clinical trial would be of benefit. Have they experienced any regulatory issues with Health Canada? I've had no issues with Health Canada. Patients are free to travel to any country to receive treatment for any condition. All medications utilized in this approach are available under prescription in Canada, and they may be prescribed for off-label practices, including cancer treatment by any physician. Do the patients do the treatment with us in Canada, or do they have to travel to your clinic? Patients interested in enrolling in the trial may travel to the US or Mexico to be formally enrolled. All patients are encouraged to travel to a trial site for enrollment. This takes 1 to 2 hours. Patients then return to Canada with a 3-month supply of medication packed and labeled appropriately. The treatment as such is taken by the patient at home. However, patients unable to travel and enroll can sign the consent form online and receive a 1-month supply of medication shipped directly to their home address. Once the patient is in a position to travel, we encourage them to formalize their enrollment in person. If we determine no benefit is accomplished during the first month, they are advised to discontinue treatment. What is my role in the trial? Patients will continue seeing their NDs and primary physicians. Primary physicians normally request lab tests, CBC, and blood chemistry every 2 or 3 weeks, as well as CT scans. Oncologists are usually aware, but maintain their distance. They will request MRI or other studies as needed. Important. Although all drugs are well known and FDA approved, we have filed for intellectual property protection, claiming a new use and a unique combination without which the effect cannot be seen. Because of this, patients are educated regarding the type of drugs they are taking, but the actual generic names of the drugs are not revealed. If you would like to know the generic names of the drugs involved, we need to complete a confidentiality and non-disclosure agreement.